that crest in this way, okay? Lie on this side, please. For the posterior, I'm going to push posteriorly. I'm going to bring him about 60 degrees of hip flexion, and now I'm going to push straight that way, right towards Jordan, right along his femur. Okay, so look at the line in his pants. That's the way I'm going to push. Straight back. Now, when I ask you to do it, I want you to open your hip up by pushing up like this. Okay? So, I'm going to push, now push up very lightly. Good. Hold it steady. I'm not pushing down, I'm pushing right towards Jordan. Breath in, hold it, hold it, hold it, and relax. He relaxes completely, and now I take up the slack by pushing straight back again. I'm not pushing down like this. Pushing straight back, he's pushing up. That's a little bit confusing when you're first learning it because you're not doing the opposite of what the patient's doing.
So you don't abducting at all? I remember doing that kind of thing about.
That's adducting him.
No, him tricking his.
Yeah, that's what he's doing.
I thought maybe he's
doing this.
No, I'm saying you as a doctor, you keep it in that neutral plane.
Yeah.
That's
because as I push, watch what happens. As I push his pelvis, as I push his femur into his pelvis, this is what happens. I get more adduction.
Mm-hmm.
That's the idea behind it, right?
And you're not really doing anything with the other hand on top.
No, just to make sure that he doesn't go whoo, sliding off the table. The red tables over in end, you know, they have that little thing cut out in the middle. That's for your pelvis. That's great for this technique because you just pop the pelvis in there and it's not going to go flying. But you know, people wear, you know, running tights or the shiny pants. They're going to go whoosh, right off the table. So you just got to holding them there. All right. The posterior, the anterior glute min. Now, how do you know which one you're on if you have a trigger point? The referral pattern. Okay? So instead of wasting time trying to figure it out, right? So anterior goes down the side, posterior goes down the back. So again, you could be in that, I don't know if I'm in the posterior anterior portion. You hit it, if it goes down the side, you're in the anterior, okay? So we're going to treat this is the posterior. The anterior, he has at the end of the table. You could do it very easily, just have the patient like this. Bend his knee up towards your chest. Come back towards me. Okay. So I have him here with my leg, so he's not going to fall, right? I'm going to lift his pelvis up, lock it in like this, and then bring this down. Okay, now this looks just like the lower QL. Lower QL, hand is up, hand on the rib cage instead, and then like that. He'll tell you it's definitely more here than it is here, right? Okay, so it's glute min, QL, that's the lower QL. Now, the way he has it is you're at the end of the table, fine. Just do it that way. Sit up, turn to face that way. The upper QL, you need the palpation on this? No? You sure? Anybody? Sideline like this, leg down, and then you lay your hands like this, and you're palpating with your thumbs. You're not doing anything with these. Okay, you want to see that quickly?
Yeah.
Line your side. This arm up. Okay, so you're just going to lay your hands down like this, and I'm palpating. Now remember, it's not right in the middle, but it's slightly posterior. It's right back here. Right there, and right there. Okay, so sit up please, face there. Up is the upper portion. Down is the lower portion, right? Okay? So remember, posterior glute min, you're pushing posteriorly. Okay, so this one. Bend your elbow so you can lean on it. Just lean on that. Let this arm dangle here. Don't support yourself with that. I'm going to wrap my leg around your hip right here, okay? Okay. So what you don't want to do is do this. That doesn't do a blessed thing, right? So you want to grab, now watch his leg. You see that? So I really pull back. Now get nice and low, and he'll tell you that's a pretty good stretch. Push back towards me, a little less. Breath in, hold it, and relax. Okay? Everybody good? Soleus, face down. Now come up between the two heads of the gastroc, push into my hand with your foot. Okay? And right there. usually we'll refer right here or refer to the PSIS here. Okay, so you wanna, sacrificing myself here. It's a big thing for me, okay? You're gonna grab the calcaneus, okay? Use your forearm, take out the slack, and now come, look at how low I'm getting. I'm gonna grab the calcaneus and I'm gonna push the calcaneus up like that. I really don't wanna do this. I really wanna do this with the calcaneus, okay? So again, you don't wanna do it like this. You wanna get under here and be able to push up like that, okay? Lower trap, sit up please.
Another towel?
Yeah, but the palpation of this, again, a lot of times when you look at somebody, you think the lower trap is down here. Can I lift this up?
Yeah.
So he's got good muscle definition. So you may be able to actually see you can see it right here. See it right here? It's right here. Now a lot of people think it's down here, but that's fine. How do you tell where it is? Put your left hand on each shoulder here. Left hand. And I'm gonna hold his elbow, now push up towards the ceiling. See it?
Yep.
There it is, okay? Now relax. So trigger points are usually in between the spine and the inferior angle. You can come in here and look for trigger points, okay? You can put your shirt back on. Actually, why don't you just leave it off, because I'm just gonna quickly demonstrate this. So I'm gonna treat this side, so I'm gonna take this hand first, pull it as much as I can, right there, okay? Now, what I'd really like to do, let go, is this. Okay, and now give me your other hand. And grab. Now I said I'm doing this side, right? So just like I'm treating the upper trap on that side, I'm gonna do this, but I'm mostly gonna do flexion. Okay? Erect the spine, now you can put your shirt on. You have the semispinalis, you have your longissimus, and you have the ilicostalis thoracis, right? So you're looking for trigger points in those muscles. So let's look up and down here. Okay, right here, we have a trigger point right here. Okay, so this one is sort of in between lower and upper, so you could choose to do either one, but you're gonna kind of pin down, grab both elbows like this. Good, lift up, reach underneath, now relax, let your head fall. What I'm gonna do is pin like this and try and use my arms here as a fulcrum. The more lateral, the more rotation, the lateral flexion, and then flexion. Semispinalis is pretty much straightforward. Longissimus is going to be a little bit, and then the ilicostalis is going to be much more rotation, and then lateral flexion. Last but not least, piriformis, face down again.
You're saying when you're doing up fibers, you want your fingers going up and lower.
Yeah, I guess. Well, you want to push up and take some slack out of the muscle first. Piriformis, there's 3 landmarks: greater trochanter, PSIS, and the coccyx. These 3, you're going to triangulate, and you're going to come right in here, and you're looking for trigger points. Now, the nice part about this is, maybe it's not such a nice thing. Face up, please. All right, so now, I just palpated this side, right? So what do I have to do? To go over here. Okay? Now watch very closely. Put this at 45 degrees. See, this is even, okay? Because you don't want to go above 60. Once I lift him up, now he's at 60. So start at 45, lift him up. You're going to adduct until his butt comes up a little bit. Now, again, right along his femur. I'm turning my body so I can lean right against his femur, straight down to the table. Okay, and now I'm going to laterally flex to take, okay? Yep. To take the slack out like that. He's going to push down like this into my hand. Okay? And that's that.
Thank you.
All right. That was quick.
Okay, Eli, I need the board.
You need a board? Oh, I thought you were just